episodic headaches to us, and then also chronic headaches, and then migraine. So we're going to, and the doctor has already explained the treatment and how to manage it. So let's now delve into the back pain. So many of us have back pain. I do have back pain sometimes. I know it's not really nice. And the number one reason that I know is that whenever I put on weight, the back pain gets worse. So when I go to the doctor will say, yeah, and what's going on? And I say, before you say anything, I've put on a bit of weight. I'm going to go on diet. So that's the cause, isn't it? The doctor will say, yes, that's the cause. That's one of the causes. It could be something else. So let's talk about muscle or ligament strain that can cause backache. So the doctor will explain that to us. So what are the treatments there? We know there's stimulation, a stimulator that can relieve the pain. So the doctor will explain that. He's going to talk about slip discs and spinal cord injuries. So let's start with that type of pain. And then we'll be talking about arthritis. That is painful as well. So please explain to us more.
So back pain, like headache, is a vast subject.
It is.
And so let me answer one question at a time. So you pointed at weight, putting on weight as cause of headache. I like a saying, there's a saying that says, it's always a loaded gun that fires.
A loaded gun that fires.
So if you have a loaded gun, you press the trigger, it fires. But if the gun is not loaded, even if you press the trigger, it doesn't fire. So if your body is loaded for any sort of these problems, brain headache, the back pain, when you get the trigger, it could be a stressful event, it could be fall, it could be a surgery, and suddenly you say, oh, I had a surgery and my back pain started after that, and unrelated surgery. The gun is loaded. And weight is one such thing. So of a lot of other factors. I mean, a lot of people who are overweight might not suffer back pain. So back pain is a very common condition. So
is it hereditary?
Strictly no. So if the family had back pain, doesn't mean you will have a back pain. But there are other things that are related to your genes that could load your gun.
Right.
It could be weight, it could be arthritis, it could be other factors. So when you have a back pain, some of the things that can help is managing your weight.
Okay.
I mean, so we are not completely our genes. The gene contribute to part of what we are.
That's true.
The rest is our lifestyle, the microbes we have in our body, the constant.
So what's that microbe?
So I mean, generally our body is filled with living organisms. We have bacteria in the bowel that processes the food. Okay. There is good bacteria on the skin that keeps the bad bacteria away. So these are the microorganisms. So we are in symbiosis with nature. So I was at a meeting yesterday at Excel, and it was called Save the Soil.
Okay.
And I'm not sure you heard of it. It is a popular movement started by Sadhguru, who's on a bike ride from today for the next 100 days, covering 30,000 kilometers,
that's a long
27
ride.
countries, to save the soil, because what we eat comes from the soil.
That's true.
And if our soil is not protected, we will lose this, and there will be food shortage in 30 to 40 years' time.
Like being eco-friendly.
Correct.
Getting the best out of the environment and releasing the best into the environment.
So this is the macro structure of our condition. If your air is not clean, your soil is not clean, your water is not clean, then we are already at a disadvantage. And then on top of it, if we do not look after ourselves, we don't eat well, we don't exercise, we smoke, we consume a lot of alcohol, we have a very stressful lifestyle.
And wrong sleeping posture.
And posture, and so these come.
And lived in the wrong way.
So these come together. So it's not just what you do to your own body, what you do to to nature as well. So you need to look after your nature, you need to look after yourself to actually have the perfect symbiosis.
That's true.
But this is a bigger picture.
Okay.
Now going to management of your back pain itself, again, the back pain could be due to a variety of reasons.
Okay.
Again, we discussed about acute pain and chronic pain. We all would have had some sort of back pain, and it is estimated that the prevalence of back pain is about 42 per thousand population, and the prevalence of
That's a lot.
asthma is about 38 to 40 per thousand. So back
So
pain,
even the back pain is worse.
back pain is more common than asthma.
See, I've had so many people who have back pain. So
Yeah.
many, even both male and female. So,
Absolutely. And back pain can be acute and chronic. If you have acute pain that has come on, the chances are with rest, you should be alright. You don't need a scan every time you have a back pain. But if you do have a back pain that is accompanied, and this is a very important point, and if I can stress that today,
Okay.
that one point is enough.
Okay.
If your back pain is associated with any numbness in your legs, that is loss of sensation, if your back pain is associated with any bowel incontinence or bladder incontinence, or you can't feel your back passage, you need to pick up that phone and get an ambulance and get it checked in
Really?
a hospital. We call this red flags. So when you have a
Back
back,
flags to what's happening? What is going to happen there?
right? So they
Is
could
it
be.
kidney? Can it be kidney?
So no, so the red flags are an indication that there
Problem?
might be a compression on the spinal cord.
Really?
Correct. So if you have any of these, leg weakness, bowel bladder incontinence,
Numbness.
and new numbness, if you had it for years, you missed the boat or there is not a big problem. Any new neurological symptoms has to be treated within 24 to 72 hours. Otherwise, you have a permanent damage to the spinal cord. So the place to
And
go.
that might leave someone in the wheelchair.
Correct. So you need to go to the accident emergency or see a neurosurgeon at the earliest if you have this. So that is acute pain. But that is not what probably we need to discuss today because that is emergencies.
Another one.
We are talking about the chronic back pain that most of us have during the course of our
To
life.
struggle or cope with.
And if you have access to healthcare, you probably get over-investigated, over-treated, and you see a lot of doctors for this.
Okay.
If you don't, or you're not aware, then you probably suffer in silence. And both are probably at the extremes. We need to arrive at a middle ground where we identify or we investigate why you have the back pain. And when we investigate, it is important to recognize
Yeah.
that when we do a scan, there will always be some sort of abnormality in your body.
Okay.
There is no such thing as a normal body. What is described in the books is an average of so many people.
Okay.
So your scan will be different from
Another scan.
your neighbor. So just because there is wear and tear doesn't mean your spine is crumbling.
Oh, right.
The scan is there not to find the cause of pain. The spine is there to make sure there isn't a cause that needs treatment or surgery.
Alright.
So disc bulge, if there's a disc bulge pressing on the spinal cord and it is bad enough to cause compression or injury to the cord, that needs to be diagnosed with a scan and be operated on.
Okay.
At the same time, you might have a disc bulge that is touching on the cord a little bit, but most people would say, you know what, that's not bad enough for you to have a surgery.
Alright.
So you need to know when not to have a treatment and
Okay.
when to have a treatment.
Alright.
But doesn't mean you don't have a treatment for your back pain. Doesn't matter there's a cause or not, your pain needs to be well
Addressed.
managed. Well managed, not cured.
Okay, okay.
We can live with
Can
pain.
it never be cured? Because when you're saying it now, it sounds like it can never be cured, just managed.
So it's about setting our expectations. So can the pain go away? Yes. But we need to start with the premise that you might have this pain for the rest of your life. If
But
you
it comes and it goes.
yeah.
Go.
So if there is a cause that can be fixed, we try to fix that cause.
That's it.
But we should not hang our hat on something that says, okay, you have a pain, your scan shows this, so I'm going to operate on this and your pain will be gone.
There's nothing like that. That might even make it worse.
It might not work, and in some instances make it worse. So think twice before you have a surgery for pain alone.
Okay.
But if the surgery is to fix a compression on the spinal cord, or a kidney stone, or a broken bone, then yes, the surgery is there to fix